So if lifestyle stuff doesn't work, what are the options? And again, I think everybody probably is aware that the GLP-1 medications, semaglutide and tirzepatide, have sort of changed the world in terms of obesity treatment. And it's been a long time, in part because the first sort of era of weight loss medications were terrible and caused a lot of heart disease. And probably no one in this webinar was around in the 90s when Fen-Phen was prescribed for weight loss and had some really deleterious effects. But look it up and you'll see that it really hampered obesity treatment innovation for a long time. And really until recently, when the GLP-1 receptor agonists, glucagon-like peptide-1 receptor agonists came into vogue. And they've been around actually a long time. They've actually been around 15, 20 years to treat diabetes. And so they are well studied and they have a well-known safety profile. And the companies basically, when they realized that some of the earlier iterations of the receptor agonists showed some mild weight loss, they actually just modified the drug itself until they found a way to keep the body's natural GLP-1 degrading mechanisms from degrading the drugs that were being given. And that's why semaglutide is different than its predecessor, liraglutide, because it stays around in the body longer and thus provides greater weight loss. And these GLP-1 receptors are actually throughout the body, both brain and gut, but they also are in the heart. And actually there's some data that show that treatment with GLP-1 agonists have cardioprotective effects that are separate from weight loss. So again, maybe not so relevant for children, but just in understanding how these things work in general, it's good to know. And again, they have the anti-Alzheimer's effect as well, and now are being used for even alcohol addiction or drug addiction. So these medications really have a lot of different effects and can be really useful for different disorders, not just for weight management. But semaglutide, which was the first of these medications with significant weight loss, has been shown to be safe down to age 12. And so it's FDA approved in the United States for treatment down to age 12. And it's actually even recommended by the American Academy of Pediatrics for the treatment of obesity down to age 12. So those data are solid and really, again, advocate for earlier intervention. And then liraglutide, which was its predecessor, their safety data down to age 6. So you really can use these medications on young patients with obesity without real concerns, or obviously you have concerns with any medication you give, but you don't have to be specifically concerned that children will do differently or behave differently or respond differently to the medications than adults do. Now, we talked about some of this stuff already, but there are insurance barriers, and in the United States and globally, the newer medications may or may not be available as well. But liraglutide in the United States has just gone to generic, so it's going to be far cheaper than it used to be. And another drug in the United States called Qsymia, which is a combination of phentermine and topiramate, has also gone generic. So they're becoming more and more accessible for most people. Now, there are a slew of new GLP-1 medications under development, and they will be coming out in the next, 6 months, if not sooner, including oral versions of both semaglutide and then of a GLP-1 sort of analog called orforglipron. And these oral formulations are going to make the drugs cheaper and more accessible, and obviously easier for people to take because they won't require an injection. And hopefully they'll get down to the pediatric community, although I don't think the indications will be in children from the outset. So I would just recommend people keep their eyes open and their ears to the ground for the upcoming developments, because this field of obesity treatment is rapidly expanding, and there are more and more options for children.